Let me welcome the acting administrator of the Federal Emergency Management Agency, Bob Fenton. This is his second tour of duty in this acting capacity, and we are grateful to him for his willingness to shuttle back and forth from his responsibilities on the West Coast to help us during these interregnum periods. We're going to examine today the agency's response to COVID-19 and other challenges in emergency management. We're thankful that you're here to testify before us in person. FEMA exists to coordinate the federal government's role in disaster preparation, prevention, and relief. And we typically see FEMA serve as an emergency manager when there's a certain area of the country that's hit with a natural disaster. But COVID-19, it impacted the whole country, and the size and the scale of the federal response has really been like nothing we've ever seen before. FEMA estimates that obligations for COVID relief through fiscal year 2021 are going to be somewhere north of $115 billion. That's more than double the Department of Homeland Security's annual discretionary budget. And I want to acknowledge at the outset all the great work that's been done by emergency management personnel at the federal, state, and local levels who have just worked tirelessly over the past year to respond to and confront this pandemic. We all thank them, your staff in particular, for their ongoing work. When COVID-19 was declared an emergency back in March of last year, FEMA was directed to lead a whole of government federal response to the pandemic. But a coordinated federal response, for all intents and purposes, did not materialize. Instead, the Trump administration decided to outsource most of the disaster responsibility to states, to local governments, and to private health systems. On many days, my state's leaders will tell you the federal government was sometimes more of a hindrance than a help. There was a lot of confusion amongst non-federal governments and healthcare providers regarding overlapping roles and responsibilities of our federal response agencies. Some days it seemed like FEMA was in charge. Other days it looked like the White House task force was in the driver's seats. Other times HHS appeared to be calling the shots. GAO cited one local public health official who said the response was, quote, incoherent, confusing, and uncoordinated. This was especially true with regard to the medical supply chain. Early on, there was a serious and damaging perception that medical supplies and personal protective equipment were not being distributed to the places in the country that had the greatest need, but rather based on other motives, whether they be political or personal. Governors and local officials who competed for months for life-saving supplies often saw the federal government redirect those supplies without explanation. Now, some might say that with the COVID threat still real and present, that this isn't the time to look backward, but we need to be learning these lessons in real time. We can't afford to just keep repeating the mistakes of the past. And while the Biden administration has straightened out much of this confusion, this committee obviously has the responsibility to fund FEMA in a way that doesn't doom us to the same failures the next time a pandemic hits. Of course, we also want to hear today about the agency's present state of operations. We need to know how the Defense Production Act authorities are being used, what FEMA is doing to ensure an equitable distribution of vaccine support, and we need to know about the financial health of the Disaster Relief Fund. And while COVID-19 will obviously be the primary subject of this hearing, FEMA does face other challenges. Currently, the agency is supporting 960 declared disasters across the country, at least one in every single state and territory. We spend a lot of time focusing on the emergency response, but we should also be talking about focusing on investments that make us more resilient. With that in mind, I'll have questions about FEMA's implementation of what's known as the BRIC program. That's the money we use to build resiliency in our communities. And we'll also want to look at how FEMA is assisting efforts at the southwest border. Senator Capano and I were there recently, and obviously FEMA is deeply engaged in helping the Department of Health and Human Services find suitable facilities for unaccompanied children and funding assistance to support local social service agencies to provide humanitarian relief. There's a lot to cover today, and I look forward to your testimony, Mr. Fenton. And I'll now turn to the ranking member of the subcommittee, Senator Capito, for any opening remarks.
Yes, thank you, Chairman Murphy, and congratulations on your first hearing. You're doing a great job so far. And I look forward to working with you and really getting to know you. We've already had, on our trip to the border, had an opportunity, even though we've served together for several years, to really forge the relationship that I think is going to be important as we move through fiscal year 2021 and begin to formulate the bill for fiscal year 2022. So I thank you for scheduling this hearing. FEMA is exceedingly important, and their role in supporting our state and local partners in responding and recovering from a historic number of disasters facing our nation. I think all of us in our individual states get to know our FEMA regional and local reps very, very well. So I want to thank the acting administrator, Robert Fenton, who I've learned obviously has very good sense because he's married to a West Virginian. So thank you for that. Thanks for joining us here today. FEMA's mission is helping people before, during, and after disasters. These words are more important than ever. And the acting administrator, Fenton, knows, and we all know, he has a big job to ensure FEMA continues to live up to that promise. We're keeping a close eye on the progress we're making concerning COVID-19, including many of the areas the chairman talked about, the various federal support mechanisms in place to distribute much-needed PPE, vaccines, and other necessary supplies and personnel to combat the pandemic. FEMA is playing an integral role in that effort, helping to support vaccine distribution centers, resupply our states with necessary PPE, and providing additional resources to ensure success. We have also been following the recent non-COVID-related disasters, including severe winter storms, damaging tornadoes. We even talked about the situation in Texas a bit, flooding and fire events across the nation. FEMA is also playing an integral role in the current border crisis, working with HHS and other DHS components to identify, procure, and manage an array of temporary shelters and processing centers for the thousands of unaccompanied children crossing our southern border. Mr. Fenton, the men and women of FEMA are a vast network of responders coordinating the full spectrum, and we want to say thank you for what you do. Speaking of the border crisis, I would be remiss if I did not say some additional words on this topic. Last month, Secretary Mayorkas acknowledged that we are headed towards more southwest border encounters than we've seen in 20 years, and the numbers are proving him correct. In March, CBP faced 172,331 encounters at the southwest border, which is 66% higher than the March of the last border surge, which was in March of 2019, where there were 103,731 encounters. We can't dismiss these numbers as a seasonal migration pattern. DHS has been forced to set up multiple influx facilities to deal with the surge at the border. HHS has already set up 10 emergency facilities to house nearly 20,000 migrant children, spending $60 million a week in conditions even HHS will admit amount to little more than crisis care. CBP was so overwhelmed that the Washington Post has reported that they are seeing 1,000 getaways per day. That's the folks we don't get and we don't encounter on the border. That's tens of thousands of individuals who are now in this country who all we really know about them is a fleeting footprint or maybe an article of clothing they left behind. In addition, CBP has had to resort to releasing illegal immigrants from custody into the United States without a notice to appear in immigration court, which is what I can describe as nothing less than a failure of our nation's immigration system. FEMA, which we are here to discuss, has been at the southwest border, and we appreciate that help because obviously describing what I am describing, it's very much needed. So, Mr. Chairman, I would ask, and I appreciate this hearing. I hope that we can, in the near future, have a discussion on this border crisis, as it is something that's staring us in the face. It's going to have a lot of input into our jurisdiction in terms of funding. And I think that hopefully that we cannot continue to encourage by policies or others migrants to come in and enter our country, making that very dangerous journey. And so I also think that we will need to make sure that CBP and ICE are fulfilling and executing their mandate under the law. Mr. Chairman, I hope you and I can work together on these goals in the future. Returning to the topic of hand, and I'll try to be briefer here, FEMA continues to see a high level of incident management workforce deployments, with only 21% of the personnel remaining for deployment to future events. I thought this was an interesting fact. Out of the 52 federal coordinating officers that FEMA currently deploys for disaster management, there is only one remaining who is not assigned to an existing declared disaster. So our manpower is getting low. The men and women of FEMA perform very diverse array of duties, and I think that's something, as we're looking at funding, we should look at. So financially, FEMA executed an extraordinary level of funding because of the CARES packages and the COVID release and the great strain on the disaster relief fund. $68 billion for state, local, and tribal assistance, including National Guard deployments, close to $60 billion remaining in the disaster fund. It would seem that our resources would be sufficient, but they're going out the door very, very quickly. So, and our data is giving us a different story in terms of how we're going to be able to maintain a sufficient level of funding for FEMA. On a personal note, as I'm sure you all, the three of us in the room here, have seen the impact FEMA has and can have during and after a disaster, the COVID response, reopening, and operating support FEMA continues to provide to West Virginia after our flood are much appreciated. In 2016, we lost 23 lives that day, hundreds of homes, millions of dollars in damages. And almost 5 years later, we still remember the things that we lost and recognize the ongoing efforts. I would like to thank you and your now Deputy Acting Administrator, Marion Tierney, who I mentioned to you was our regional director, for her and your continued attention to this recovery. So that's one of the, did you say 900 disasters that are still ongoing? It's just, and it takes so long sometimes to rebuild. So thank you for appearing with us today, and I look forward to hearing your testimony. Thank you.
Thank you, Senator Capito. By way of introduction, our witness is the acting FEMA administrator, while not serving as the acting administrator. Mr. Fenton is the FEMA Region 9 administrator. It's a career position. He's been with FEMA since 1996, and he's been involved in a number of significant large-scale response and recovery operations, including Katrina, the Southern California wildfires of 2003, and the 9/11 World Trade Center terrorist attacks. We appreciate you being before us today. Following your opening statement, each member is going to be recognized by seniority for up to 5 minutes for statement and question.
Well, good morning, Chairman Murphy and Ranking Member Capito, and members of the subcommittee. Thank you for the opportunity to discuss FEMA's role in response to the COVID-19 pandemic. This is really an unprecedented challenge that has claimed the lives of over 558,000 of our neighbors, friends, family members across the country, caused grave damage to the global economy, and put a spotlight on inequities throughout our nation. At FEMA, we are committed to ensuring that everyone has access to vaccination. This is our highest priority, and its success is dependent upon the whole community being unified to achieve this goal. Our current work can be grouped into three broad categories. First, at the President's direction, FEMA is reimbursing 100% of the costs of the Title 32 National Guard activations, as well as 100% of eligible emergency protective measures expenses incurred by states, local, tribal, and territorial partners in response to COVID-19 through September 30th. This includes reimbursement for vaccination efforts, screening and testing, and personal protective equipment. The President also directed FEMA to expand the eligibility of emergency protective measures from January through September of this year to support the safe opening and operating of public facilities. This includes, among other things, eligible schools, child care facilities, transit systems of those that have been impacted by COVID-19. Second, FEMA is working to support state, territorial, tribal, and local governments-led community vaccination efforts, also known as CVCs. FEMA is doing this through the deployment of federal personnel, the provision of equipment, supplies, and technical assistance, and the awarding of expedited financial assistance. Third, and finally, FEMA is teamed up with the Department of Defense and other agencies in establishing pilot CVCs across the country. These sites are stood up in partnership with state and local authorities to better reach underserved and historically marginalized communities. These CVC sites come with additional temporary 8-week vaccine allocation and is above and beyond the normal state allocation, and some can administer up to 6,000 vaccinations a day. As of April 12th, FEMA has obligated more than $4.53 billion for COVID-19 vaccination efforts. There are 1,567 federally supported vaccination sites and 357 mobile units, including these 30 pilot community vaccination sites that have been stood up since January 20th. To date, 189.6 million vaccine doses have been administered across the United States, with 172 million of those taking place since President Biden was inaugurated. Furthermore, the administration has been able to provide states and territories with a 3-week vaccination supply allocation. As of early April, this allocation stood at approximately 26.8 million doses, and over the last 3 weeks, close to 90 million total doses have been sent to states, tribes, territories, and through federal channels. President Biden has made equity a cornerstone of the administration's COVID-19 efforts. And at FEMA, we've established a Civil Rights Advisory Group with our federal partners to ensure equity is incorporated into all of our activities. Since its inception in January, the Civil Rights Advisory Group has supported the development of the methodology to use to determine federally led community vaccine pilot site selections, has worked with all 10 FEMA regions to collect and analyze demographic data, has identified underserved communities, and collaborated with community-based organizations. As of early April, 58% of all doses administered at the federally led pilot CVCs went to communities of color. We have reason to be hopeful in the months ahead. We expect that vaccine supplies will continue to increase substantially in the months to come, so that everyone who wants a vaccine will have access to one. In closing, we greatly appreciate the subcommittee's steadfast support for FEMA's efforts throughout the COVID-19 pandemic and for appropriating the resources our agency has needed to meet the historic mission requirements. I'd just like to end with saying how much of an honor it is to be the acting administrator and lead, in my eyes, the finest group of civil servants that I've had the opportunity to work with. Their ability to work tirelessly through disaster after disaster to help Americans when at the greatest need just shows you how dedicated this workforce is in the challenging times that you've all highlighted. So thank you for taking the opportunity to testify, and I look forward to answering your questions today.
Thank you again. Thank you very much for your service and your willingness to talk to us today. You obviously have had a unique seat managing a regional response to the pandemic. And as I mentioned at the outset, I do want to focus on present efforts, in particular the vaccination campaign, but I do think it makes sense to do some retrospective here to make sure that we are learning lessons in real time. And so I wanted to turn to this question about overlapping responsibilities. FEMA was given this lead role in the whole of government federal response back in March of last year. But as you know, there was widespread confusion amongst policymakers and state level implementers about who was in charge, whether FEMA was in charge, HHS was in charge, or the White House was in charge. We can't sort of wait to do a year-long retrospective and inquiry before trying to make amends for that confusion. So I'd love your perspective, having sat in Region 9, to tell us what you think FEMA's role should be, let's say vis-a-vis HHS, during a nationwide public health incident like a pandemic. How can we learn from our mistakes over the last year to make sure there are clear lines of authority for state and local public health officials, governors, members of Congress?
Thank you, Congressman, for Senator, for the question. Apologies. Let me just start off by saying the last year was the most complex event that I've ever had the opportunity of responding to in my 25 years of being in this field in emergency management, and is really a maximum event. Never did we anticipate that we would have such a large event not only impact the nation's capability, but let alone the world's capability. And so when you look at events like this, I think emergency management at all levels of government has a responsibility to be a coordinating function. And I think that is something that FEMA does really well, is coordinate and communicate all levels of government, both vertically and horizontally, and connect with not only government, but private sector, private nonprofits, and others to ensure that everyone is working toward a common set of goals and unity of effort. It's difficult. It was difficult to do last year at the beginning of the event because of the different authorities, the uniqueness of the medical event, and starting off with the event being managed by HHS and then eventually transitioning in March to FEMA taking the lead of it. It took us a little bit of period of time to get the coordination mechanisms that traditionally haven't been involved in a medical-only event to come together and unify those efforts at all levels of government across a private sector, private nonprofit. And it's something that we continue to work on and improve throughout the summer and in response to COVID.
So I spent about a month last summer trying to understand the emergency medical supply chain and trying to understand who from the federal government was doing what. I spent about a month talking to anybody that I could, and I think I left that month more confused at the end than I was going in. And in fact, in the report that FEMA released in January, FEMA noted that neither HHS nor FEMA understood the domestic supply chain at the beginning of this response. So to what extent were agencies aware of this knowledge gap, and what's being done right now to identify and manage those gaps in advance of future incidents? And then who really should be the lead with respect to this question of supply chain management? Should this be FEMA? Should this be HHS? And how do we make sure that we're not sort of caught unaware in the way that we were last spring and summer?
So from the organizational standpoint, the National Response Coordination Center, when stood up nationally, is the overall coordinating mechanism. What they did was establish a supply chain task force to focus in on the medical supplies of this event. And it took them some time to get a hold of and an understanding of that supply chain. It's very complex as far as who are the big manufacturers, where's the manufacturing happening at, where are the resources needed to do the manufacturing, what is the capacity of that within the United States, with outside the United States. And so those were all things that took them time to kind of wrap their hands around. At the same time, funding is going out to state and local governments, and they're taking the necessary action to go procure the needed resources to be able to combat COVID. So there is a little bit of complexity at the beginning to get unity of effort going, and it's something that we continue to work through during the summer months. Going forward, there's a number of things that are happening right now. There's specific, not only does FEMA have a role to provide coordination, and through executive order last year, had some responsibility to look specifically at some of the medical supplies. But more importantly, we have now a much better understanding of our supply chains and understanding that a just-in-time supply chain isn't sufficient to meet the challenges of a worldwide pandemic. And so what we've done over the last year is be able to understand that supply chain, understand where those manufacturers are, what their capability is within the U.S., outside the U.S., where the resource dependencies at. And what we're now doing is working to build capability and relationships to better be able to share information, to include stockpiling resources both within the federal level, at the state level, but more importantly, ensuring that private sector is part of that, and they're also building capability, and that medical institutions are doing the same thing. So it's really a whole of community effort, recognizing that everyone has parts and responsibility of that, working through each organization's authorities, with FEMA assisting and coordinating many parts of this.
I'm going to turn this over to Senator Capito, but I do maybe on a second round want to follow up with you with this question of how we learn from our experience in overlapping distribution systems and procurement systems, whether it's appropriate to have state systems overlaid with federal systems, overlaid with private sector systems, and how we can sort of learn from that duplication of effort. But at this point, I'll turn it over to Senator Capito to be followed by Senator Sheen.